Thank you, Miriam. And thank you, everybody, for joining us today on our webinar. One of the things I'd like to start off with is really talking about what is Epic Community Connect, right? So first off, let's just talk about what is that product from Epic. So as you've seen and come to know, Epic adoption is widespread across many healthcare organizations today. And this has actually led to the increased adoption of Epic Community Connect, ECC, as a cost-effective approach for healthcare organizations. The model allows affiliate facilities to be on the same EHR platform as their hosts, which helps improve the continuity and quality of care for patients while also improving organizational efficiencies. What Imprivata has done, Imprivata has developed a solution that complements Epic Community Connect and allows sites to unlock the full potential of their EHR by ensuring fast, convenient, and consistent authentication across all clinical and enterprise workflows. So let me just start off, before I dive into our Imprivata for Community Connect solution, I'd like to walk you through an example of how Imprivata helps streamline clinical workflows overall. If you're an existing Imprivata customer today, one-time customer, you're likely very familiar with the workflow, but I think it's, again, important to start off with this. So let's start with workstations. Today, when clinicians walk away from their workstations, they may not remember to log out. So this means that workstations may be left unlocked throughout your facility. And this can lead to loss of PHI, and even situations where physicians get to a new workstation and start charting under the wrong patient. So with Imprivata, workstations are no longer left unlocked when unattended. Another challenge that we find is that clinicians log into their clinical systems on average 70 times per shift per day. And it's an incredible burden on them and on their patients who have to wait, right, while their physicians are logging into these systems. So with Imprivata, usernames and passwords no longer block clinicians from patient care. And in fact, usernames and passwords are replaced with a badge tap or a fingerprint swipe. So this is the same benefit we provide for virtual workstations. Today, virtual workstations represent another layer of authentication into another system for clinicians. So Imprivata removes this other barrier by allowing that same badge tap into the workstation to grant them access into their virtual workstations. There's also the ability to roam the hospital and get logged into the same desktop instances no matter where a clinician may be in the hospital. This is, again, an incredible time saver for clinicians who need to access systems multiple times per day. It gets them to their patient's data a lot faster, thus improving their experience with technology adoption And it ultimately improves care delivery. Right, so overall, we find that clinicians save, on average, 45 minutes per shift per day using Imprivata. Now, let's say clinicians want to electronically prescribe controlled substances, and there's EPCS mandates, are spreading across the U.S. There's new states every day that have introduced EPCS mandates. So to do that today, you would require another set of passwords and authentication methods to meet these DA requirements for EPCS. So Imprivata improves EPCS workflows by establishing trust and enabling the physician to prescribe substances through their Epic workflows. Now, Imprivata also provides two-factor authentication, such as fingerprint scanning, to complete the prescription in a DEA-compliant manner. So once the physician is done, they can simply tap their badge to lock their workstation. If they forget to do that, Imprivata has a solution, right? So each workstation can fade and then lock automatically to ensure top security. Additionally, Imprivata offers fast user switching to enable another clinician to simply walk to a workstation, tap their badge, and get automatically logged into their system and applications, helping prevent charting under wrong patients. So when you look at these these improvements as a whole, you can see that we focus on streamlining clinical workflows, which in turn enhance the hospital's approach to security. It's a true win-win for IT, the business, clinicians, and most importantly, your patients. So with that said, let's focus now on Epic Community Connect environments and where Imprivata fits into that equation. So it's clear that the EHR is at the heart of healthcare, especially in these Community Connect environments. So Epic Community Connect, as I mentioned earlier, enables healthcare organizations to create a community hospital, right, where host facilities can provide access to their Epic instance to a number of other, usually smaller provider practices, right? So there's a demand today for streamlining clinical workflows and facilitating access to the EHR. But as we've discussed, passwords that restrict access to these systems can be an incredible burden on clinical staff. There's a demand for more streamlined access and fewer password barriers. And this demand is driven by clinicians who need fast, secure access to data when they're treating patients in critical situations. It's a demand from clinicians who routinely prescribe controlled substances and can't waste time with usernames and passwords each time they log into Epic and other applications. So it's a demand also from IT, who is burdened with help desk calls every day when end users forget their passwords and need immediate access to the systems. So ultimately, the success of the EHRs that organizations deploy depends on the clinician adoption rate. And if clinicians are bogged down when they access these systems, these adoption rates and successful use of the technology will plummet. So Imprivata for Community Connect provides seamless authentication and access into Epic for your end users. The solution helps to streamline workflows for affiliates who participate in Epic Community Connect. Imprivata for Community Connect, which from now on I'll simply call ICC, provides consistent, fast, secure access and authentication into Epic Hyperspace. The solution allows you to replace usernames and passwords with a simple badge tap or fingerprint scan to help decrease the potential for phishing and other cyber attacks. And it supports integrated clinical workflow automation for Epic Hyperspace. It also enables organizations to comply with DEA requirements for EPCS, which is something that, as I mentioned earlier, is increasingly important across all of healthcare. Now, you may be wondering, how does Imprivata for Community Connect work? So, in order to provide streamlined clinical workflows to access your hosted instance of Epic, a connection to your host facility must be made. In the past, that host facility may have had to provide and maintain a dedicated server farm for each of their affiliate facilities just to power their affiliates' use of one-sign SSO into Epic. This would be very expensive for both the hosts and their affiliates. So because of this, many host organizations, acute care facilities, would refuse to provide the required server infrastructure. And if they did provide it, the cost would be passed down directly to the affiliates. So what we've done with Imprivata for Community Connect is to support it with a new Imprivata connector for Epic Warp Drive. So by leveraging Epic Warp Drive, you now have the ability to use Imprivata for single sign-on into Epic Hyperspace and support clinical reauthentication workflows without the need for a dedicated server farm managed by your host facility. This is a benefit and cost saving for both the hosts and their affiliate facilities. Affiliates get to experience the benefits of Community Connect without the need for dedicated servers for SSO functionality from their hosts. And it's even a benefit for hosts who can now support single sign-on technology for their affiliates without having to maintain dedicated server farms for each affiliate facility. Now, one key point I do want to bring up is that Imprivata for Community Connect is sold only to affiliate facilities. So if you're a host facility and you want your affiliates to leverage our solution, we would be happy to schedule that separate time to speak to them. Or if you host periodic meetings with all your affiliates, we can attend those and discuss our solutions with them. Right? So overall, Imprivata continues to drive integrations with Epic, and our Imprivata for Community Connect solution is the latest example of this. Right? And while we can talk about this as a company, I think what I want to do, and part of why you guys have joined this webinar is it's much more impactful to hear those success stories directly from our customers. Right? So with that, I'll stop right there. I know I've spoken quite a bit for the last 5 minutes or so. I'd like to introduce Daniel Lawrence from Great Plains Health. So Daniel, welcome. And before we jump into our discussion, please just tell us a little about yourself, your role at Great Plains Health, and your experience with Imprivata over the years, because you've been an Imprivata customer for quite some time now, right?
Correct. Thank you for having me. Like you said, my name is Daniel Lawrence from Great Plains Health, and we just recently rolled out Epic handful of months ago and rolled out ICC. So we have been an Imprivata customer for quite a while now. Was a previous single sign-on customer before, and Imprivata is much easier solution. We've been really impressed with them and are happy with the relationship we have with them and looking forward to more that they offer going forward.
Excellent, excellent. And one of the first questions I have here for you, Daniel, is in terms of switching to ICC and in terms of switching to Epic Community Connect as well. I'm wondering what drove the EHR switch for you guys, and what were the biggest challenges that came with that? And thinking about that, how was Imprivata for Community Connect? How has it contributed to tackling those challenges for you guys?
Yeah, so we did quite a bit of research, and it's been a couple-year process, but using Epic Community Connect was the most viable option to use in our facility. We like the idea that we can leverage the configuration expertise of Nebraska Medicine, who is our host site, and Epic themselves to improve patient care. Some of the challenges that we saw was getting the specific configurations figured out from our facility compared to the other facilities that Nebraska Medicine hosts. Obviously, we're not the only spot that they host, so other places had their specific configurations that we needed to change. So there was just a little bit of work-through process with that. And then our biggest challenge, and we're still working through this now, is our wide area connectivity and making sure we have the redundant and high enough internet speed to handle the connections. We've had some small downtimes because some of those became issues, but we're looking better as that goes through and kind of got that figured out. So.
Excellent. Yeah, that's great insight there from that perspective. So thinking about the end user experience, I'm wondering, what's the end user experience with Imprivata for Community Connect now? Again, you mentioned that you guys had been Imprivata customers before, so now switching from kind of the traditional architecture and structure to Imprivata for Community Connect, can you discuss feedback from clinicians and what the value is that you've gotten from that seamless SSO experience into Epic?
Yeah, of course. So, like you said, we've been Imprivata for a while, and our physicians and nurses and all of our staff have been really impressed with it. But now that we're using ICC, I mean, things are better than ever. A real big win for us has been the speed to connect to Epic. If you are the first to log on to Epic for the day at an Imprivata workstation, or if there's been no activity at a workstation for around an hour, Epic will take about 20 to 30 seconds to load. Most of that is the Citrix connection, not really loading the Epic application themselves. But if you're logging in after a user who was already logged in, or if somebody's been logged in within an hour, you can get into Epic in less than a second, maybe 2 seconds at most. So that kind of speed is something that we have never been able to see before. And that quick login to our EHR has been a huge success with all of our end users. Our other big win that we've had since rolling this out has been with our physicians and them being able to e-prescribe controlled substances. If you're not familiar with that, it's using an app on your smartphone called Imprivata ID and a little quick enrollment process in the Imprivata console. Physicians can send controlled substances straight to the pharmacy instead of printing and signing them. This works simple inside Epic. When a physician goes to sign a prescription, they have an option to e-prescribe and sign. When they click on that option, the first box to pop up is their network password, and then the app on the phone will pop up a notification screen that the physician will just click approve on their phone, and the prescription is sent directly to the pharmacy. So that's been really smooth and a huge time saver for us. Some of the other keys we've had to make things smooth for our end users is understanding how the Epic Warp Drive works. This is a piece of software Epic uses to connect to Citrix with a specific account so the end users do not have to log into Citrix. That way the connectivity is already there, and that's how you speed up the process after somebody else has already been in. And from an IT side, we've also been really happy that there's no software to load on the Citrix servers themselves. So with our previous EHR, we had to work with them to load any upgrades or any kind of Imprivata agents on their Citrix servers. And with this solution, none of that is needed. So we can upgrade on our side Imprivata anytime that we need and have no issues with their hosted site. So that has been really nice with us.
Excellent. No, that's really good feedback, and I like that you've talked about that the clinician's end user experience, but also the IT folks' user experience as well. So I think that's an important part to kind of think about how the solution really brings those two pieces together. So kind of along those lines, I'm wondering, how are the needs from clinicians identified? Is there a feedback loop between IT and clinicians? Essentially, what are ways of continuing to address that demand, for technology for your clinicians?
Yeah, so I've been in communication with physicians from the start and still work with them pretty closely. It lucks out that I am also our cell phone guy. So we give physicians cell phones when they first get hired. And since I'm also the Imprivata person, it's been really slick for them to give me feedback. So I communicate with them all the time and get a lot of feedback, which has been really good for us to address some issues. So if they have any issues, I will take care of the ones that I can, or I can get with our IT clinical staff to get them resolved pretty quick for them. So I think this has helped with transition and also will be a key for our future communication, that they can still give us feedback even after we're live and maybe feel like some things need to get changed. Another piece of feedback that's been really important, and I still hear from them, is they were extremely happy that we had Imprivata on site before and during the go live. So their expertise can be levied before to get questions answered so they were ready, and during, when, of course, once they start using it, they have more questions. So that was huge for us.
Excellent. So last question here I have for you, Daniel, is in terms of feedback, what would you tell other organizations considering a similar EHR switch? So best practices for leveraging ICC to maximize the benefits of the EHR.
Yeah, so kind of like what I just said, I strongly recommend having Imprivata on site a few weeks prior to go live and during go live. We have them come on site prior to set up our physicians with the ePrescribe so that they were ready day one and there was no enrollment set up. And then the day one go live, of course, any new questions that came up, they were on site, they could answer quickly, and they could go work directly face-to-face with the doctors, which, is how they kind of want things to be done. We really didn't have much of any Imprivata issues during go live. It was tested prior, but we did have some physicians who still needed to enroll in EPCS that I would not have had time to take care of myself, being busy with going live and other issues that IT had to take care of. So for me, a couple things that I would definitely recommend is just do not go at it alone. Make sure you have somebody here to lean on that would help, because you're just not going to have the time. And then for the initial setup piece, again, we leaned on Imprivata heavy to work with Nebraska Medicine for the site configuration piece. And we would not have been able to get it done without them. There was some documentation to follow, but there was some specialty that needed to be done that nice, back and forth between Imprivata and our hosted site was definitely needed to get that configuration piece up and running, and everything went smooth after that.
Excellent. Well, that's certainly what we like. We definitely like to hear that. So, Daniel, those were all the questions I had for you. I think it's really good for the audience to have really heard your experience and how you guys have really tackled that switch from the traditional Imprivata architecture that you guys had to now this Imprivata for Community Connect architecture. So that's awesome. And I think I'll go ahead and pass it along here to Miriam for any questions from the audience. Thank you.
Yeah, thanks, Joelle, and thanks, Daniel. We actually have quite a few questions coming in right now. So I'm going to start with one that I think you did mention this, but one of the questions is, do you use Imprivata for remote two-factor authentication as well?
So I think that question's for you, Daniel. Are you guys using Imprivata for remote two-factor authentication over there at Great Plains?
Yeah, I'm sorry, I muted myself and forgot to take me off. Yeah, so we offer Imprivata using a VDI system remotely. So we do have that set up to where you can remotely access Imprivata. it's not so much a two-factor. It's just using your network password. In-house, we have the badge or the password, so not really a two-factor with Imprivata themselves. The only piece that's two-factor is the e-prescribe.
Okay, great. And then this question goes in line with that. So the level of work to build the Imprivata environment for EPCS and single sign-on piece, what's your perspective on that, on kind of the workload?
Yeah, so we had Imprivata come and work with me on site to get it built on the admin console side. The configuration's not difficult by any means, and it's well documented. Could be done by yourself, but like I kind of mentioned, the expertise of having somebody on site who's done it before and, could go back and forth with my hosted site, was a real benefit. So not difficult. I think the whole work was done, in a day, and the documentation is really nice to follow.
Okay, great. Another one, and this kind of sums up a few of the questions that we've gotten, is do our hosts have to do anything on their end to make Community Connect work?
So I can tackle that one.
Oh. Okay.
I'll start with that one, and then maybe I'll toss it over to you. But from our perspective, we see that really the main requirement from the host side is that they deliver Epic to their affiliates via Epic Warp Drive. Besides that, there aren't any major real requirements from that perspective, right? That's part of the benefit of the Community Connect solution. Now, we understand every environment has its own intricacies, its own individual differences, but for the most part, really, that's the key requirement from the host, is being able to deliver Epic via Epic Warp Drive. But I'll toss it over to you, Daniel. What did you guys find in terms of from the Nebraska Med side of things?
Yeah, I can just say them being a host, something that they were really happy with was not having to load any kind of agent on their Citrix servers. So there for a little while we thought that they would have to dedicate a handful of Citrix servers just to us and then to their other sites. And then once they found out that that was not needed, I mean, that was a huge success for us.
Great. And can you remind us again, Daniel, who your VDI provider is? I believe you said Citrix.
We actually, for our VDI, we use VMware.
Oh, you do? Okay, great.
Yes, yep. Citrix is the connectivity for Epic to Nebraska Med, but our actual VDI provider is VMware.
VMware, okay, great. Thank you. Let's see, we also have a question. It says here, if I'm an existing Imprivata customer, do I need to buy all the hardware again to switch to ICC?
So, yeah, so that's been sort of answered. There is some reconfiguration that you'll need to do in terms of the Imprivata connectors, but there is no need to replace your appliance, and there's no kind of need to rehaul everything and start over again. If you are interested in ICC, a member of our technical team will walk you through kind of what's needed to make that switch. But that's kind of how we perceive the switch. Now, again, I'll toss it over to you, Daniel. Any insight you can provide there as to what you guys had to do to switch over?
No, the only thing that we were running version 4.9. We were behind on times. So the only thing we had to get ready was not hardware related, but software related. To use ICC, we had to get up to 5.4. So that was the only concern we had, but that was more just because we got behind.
Okay.
That is looking like all of our questions, actually, for today.
Okay.
So,
excellent.
So we can wrap it up. Did you have anything else to add, Daniel or Joelle, before we leave?
Well, I think one thing I will add is, we've built the solution really for because we really understand or try to understand those workflows between Epic and Imprivata, and really driving those key, the key simplicity of what we do here with Imprivata. I think the challenge that we really solved, and Daniel, you hinted at that earlier, is, this solution provides a benefit for the host, right, because it now doesn't force them to have to maintain separate server farm just for Imprivata software, and we see hosts that are either Imprivata customers or not Imprivata customers. It's kind of it doesn't matter for the sake of being able to use Imprivata for Community Connect for affiliates, right? So you can have an affiliate whose host is an Imprivata customer or is not. It kind of doesn't really factor into whether you can leverage ICC as an affiliate. So that's really the beauty of what we built here with Imprivata for Community Connect. So teams really put a lot of work into the solution. We launched earlier this year, and we've seen some really good feedback from the customers who have adopted the solution so far. So really awesome to see the great engagement from customers already.
Yeah, actually, and we just had one question come in that I'd like to address just before we hop off here, but it says, what if both facilities already have Imprivata?
Yeah, that's a good question. So that likely makes the conversations a lot easier, right? Because there's already relationships established between both organizations. But again, as we've mentioned here throughout our webinar, Imprivata for Community Connect is sold to the affiliate. So you as an affiliate organization, I'm not sure who asked the question, but if the person that asked it is part of an affiliate organization, you work directly with us, and we'll, same as Great Plains and Daniel, we will work directly with you to get you, converted over to Community Connect. From the host perspective, there's really, again, no major requirements there other than to offer Epic via Epic Warp Drive. But that's about it. So it's actually, I guess, simple answer to the question is that's great. Relationship's already been established. It makes the process a lot easier. But, it doesn't have to be the case. It may be that neither of them are Imprivata customers, and we'll be happy to work with the affiliates on that transition.
Great. Thanks, Joel. All right, I think that's it for the questions today. Thank you again to Daniel, who joined us and talked to some of our other customers and provided great insight. We really appreciate you taking the time today, Daniel, so thank you. And Joel, thank you for your add-on comments there. So I think we will wrap things up. I did want to let everyone know that if you do have additional questions about what you've heard or seen here today and would like to request a demo or just talk to somebody over the phone, you can reach out to your customer success manager, or you can send us an email at sales@imprivata.com, and someone will respond back to you. And as a reminder, today's session was recorded, and it will be sent to all registrants in the next few business days. So thanks again to everyone who joined us today, and I hope you enjoy the rest of your week. Take care.
Thank you, everybody.